This past summer marked 2 years since the Supreme Court ruled on the Dobbs decision, which overturned Roe v. Wade, the case that protected the constitutional right to an abortion in the United States. A new report out today by the organization Pregnancy Justice takes a look at the consequences of that decision, reporting that in the first year after Dobbs, at least 210 pregnant people faced criminal charges for conduct associated with pregnancy, pregnancy loss, abortion, or birth. Dana Sussman is joining us now to discuss. She is the Senior Vice President of Pregnancy Justice, an organization that advocates for the rights of pregnant people who completed this report. So this is really interesting, and I think people will be stunned by this, by the ripple effect. First off, let's just get into kind of the highlights, if you will, of the report. What were the highest numbers of prosecutions, and where did they happen?
Right. Thank you. Thank you so much for having me. Our report documents 210 cases of pregnancy-related criminalization in the United States in that first year after the Dobbs decision, the decision that overturned Roe versus Wade. The highest number of cases come out of the state of Alabama, nearly half of all cases in our study. Oklahoma is next at 68 cases, and then South Carolina, Texas, Ohio, all show up in our study. But what's important to note, too, is that 12 states had at least one case in our study. So this is not concentrated just in, one might assume, red states, but this is happening across the country.
So then what are we talking about here, though? Because I think people are going to hear that and say, well, were these people trying to get an abortion, past the time? What sort of charges are we talking about?
So that's not exactly what's happening. One important piece of information people should know here is that of these cases, 22 women were charged in connection with their pregnancy loss. So in a post-Dobbs America, pregnancy and pregnancy loss are more and more suspicious. They're treated as suspicious events worthy of investigation and potentially prosecution, when they should be treated as tragedies and as health care. And people are not being met with the care that they need. They're being met with handcuffs.
So I'm just going to use kind of the term that most people are probably familiar with, which is a miscarriage. That somebody could be suffering a miscarriage, and then instead of being treated like someone going through a health crisis, there is suspicion. And this brings me to this. The majority of charges allege substance use during pregnancy. What are these charges?
Absolutely. So in the majority of the cases, we're seeing charges of child abuse or child endangerment during pregnancy. And I want to just give you an example of Alabama, the state that represents the most cases. Earlier this year, Alabama made a lot of headlines when the Alabama Supreme Court determined that frozen embryos used in IVF were children for the purposes of the state's wrongful death statute. 10 years earlier, that same Supreme Court ruled that under Alabama's criminal laws, fetuses and embryos were also children. And since then, hundreds of pregnant women in the state of Alabama, and also in our study, have been charged with child abuse or child endangerment for behavior that a prosecutor, not a health professional, but a prosecutor or police officer believes is risky for their pregnancies. This could be someone who has a substance use disorder and discovers they're pregnant. This includes people who use prescribed medications for physical or mental health conditions that they have before they're pregnant or while they're pregnant. And so this is connected both to the abortion fight in this country and the rights of people to retain their own bodily autonomy, and to IVF. This is about reproductive needs and decisions and healthcare across the reproductive health spectrum.
And the thing about these sort of charges is prosecutors don't have to actually sort of prove that the fetus was injured or hurt or harmed in any way. I don't know how you would do it.
Right, exactly. In the vast majority of the cases in our study, the laws that prosecutors are using do not require a showing of harm, meaning that this is simply about behavior that a prosecutor, again, not a healthcare professional, believes might be risky, might expose the pregnancy to some risk without even needing to prove that there was any harm at all.
What is the overall message that you want people to get from this report?
We need to separate healthcare from criminalization. In a country with a maternal health crisis, pregnancy should be a time of joy and support and healthcare without surveillance and suspicion. But what we are seeing is pregnant women are worried. They are scared. And we saw that in the recent tragic deaths that we learned about last week in Georgia, Amber Thurman and Candy Miller. They were scared to get care, particularly in Candy's case. She did not seek the care that she deserved because she was so scared about the laws in her state. And that is really, it's terrifying and it's tragic, and we need to reverse course.
All right, Dana Sussman, thank you so much.
Thank you.